The concept of convincing the patient. In the past few weeks, I've been thinking a lot about this. From the extreme of one colleague who says that, patients don't often know. You can fill in the blank, but basically know anything medical, right? I give you that. They're not medically trained. But our point is they have so much wrong misinformation that they're not to be trusted. They get their information from TikTok, not accurate, often wrong. And so, can they really make their own judgments, make their own decisions when they don't even have the right information? When they believe things that are just absolutely stone cold wrong? I mean, my first response would be that I don't know that they're stone cold wrong. Medical knowledge is not static, it changes. We learn more, and things that we thought were true or could be wrong. I mean, you think all the millions of people who thought their Earth revolved around the sun revolved around Earth thought they were wrong? The intellectuals. But I think the bigger issue for me is what about convincing a patient who you are sure is wrong, you are sure is making the wrong decision? So recently, I took my father-in-law to see a doctor, multiple doctors, shall we, because some doctors had told him he shouldn't be taking this medicine, the beta blocker. I don't see why not. It's no big deal. In fact, it's probably a good thing he's taking it. But he says two doctors conferred and they both agreed. Like, okay, that doesn't mean a thing. Two stupid people agree on something, and that means one smart person said yes. But I can't convince him, so let's talk to some doctors. So there's a lung doctor he sees. The doctors who are not lung doctors said it is bad for the lung. Let's see what his lung doctor actually thinks. His lung doctor says that, not necessarily the worst thing, but I would say that if the heart doctor says he needs it, he needs it. I thought that was pretty well fixed, but apparently he didn't hear the same thing. He heard that it's dangerous. I mean, he did say it could be bad. If you're having a flare of your asthma, then yeah, you would want to stop it. But you're not having a flare. You haven't had a flare in ages. So next, you go to the heart doctors. I found him another heart doctor. So we went to two. The one he saw before, who's the head of the department at a public hospital, the other doctor in a private hospital. Doctor in a private hospital we saw first, he says yes. Serves two purposes. Very good. Take it. Done. Went to see the other heart doctor that he saw before, the head of the department. He says, first line. So yes, done. Or so I thought. Then I find out later that, oh, wait, so you're being describing a different one? What happened? I didn't know because something went on, and I asked my wife, and there we go. He had asked for an alternative. Wonderful. And I'm thinking, is this a good doctor or not, right? I mean, he knows his stuff medically, but he didn't spend the time with the patient trying to convince the patient to do the right thing, to do what's best for him. Instead of giving medicine that could potentially have more side effects and doesn't treat two conditions. So I chewed upon it. I pondered it. And now I have come to the conclusion that yes, this is the right thing to do. Why? Because you realize that you can't convince him. And I think that's the difficulty in life, right? Like, people want to try really hard. A lot of doctors want to try really hard. They think you're just giving up on a patient, not trying hard enough. And they don't understand there's a concept called futility. You understand that when it's medical futility, right? You're trying to save a patient's life that cannot be saved. That's called medical futility. We see many of those. We treat many of those. We do it because this is America. You just do what a family wants you to do. Who cares whether it's purposeful, useful, or not, right? But we don't understand the concept of futility in convincing or persuading people. We started to introduce this concept and the idea of smoking cessation. At least I think most doctors understand this in the sense of smoking cessation. Because in smoking cessation, we have the concept of different phases people are in. So if you're in a certain phase, right, then there's no point spending a lot of time trying to convince you because you're just not ready. It's called pre-contemplation. You got to move from pre-contemplation to contemplation. If you're not even contemplating, openly thinking about something, open-minded enough to consider, then there's no point talking about this because it just won't work. And that's research proven. Now, I'm not saying this is 100%, but nothing I do in the medical field is 100%, right? A drug you give is not 100%. You just can't guarantee things. But this is pretty good, 95%, which is better than most drugs we give. And thinking back to my own experiences, right? So I had this patient who came in for overdose. So she's sort of zonked, waking up slightly, still not come to, not really opening her eyes, just sort of moving, moaning. And I found like, she's normally on some narcotics. I think she's undergoing withdrawal. And I say, yeah, I completely 100% agree with you. But she overdosed on a different medicine, and she's not really with it, and I think that would just set us back. Because narcotics affect your mind, and she's not even normal yet. Not even close to normal. And they all agree she's not close to normal. So I would recommend holding off on it. Now, when I say recommend, I have the power, because you can't order something without me. And in the hospital, you don't get other medications anyway. It's not me ordering it. But I don't have the power, in another sense, because I'm only here for a little bit. As in, I'm here during the day and gone at night. I'm not staying there 24 hours. Almost nobody does. And so another doctor is going to be on. So I really tried hard that day. I spent a long time, half an hour in the morning with the son, the daughter. And then the nurse paged me. Oh, family wants to talk to you about this. You're like, really? I go back. It's another son with the same daughter. I thought she could just explain it. But anyways, that's fine. Spend another half an hour. I thought we're on the same page. And guess what happens? Overnight, she gets given narcotics because she's in pain. So I wasted a good hour, maybe more, for nothing. As in, literally nothing, right? There's no partial accomplishment. It's just time wasted. I didn't achieve anything. And I think that if you think about, futility there, I think as you get more experience, you have to understand when it's futile to try to persuade a patient and when it's not. When is your effort going to be 50% successful? When is it going to be 20%? When is it going to be 90%, right? When is it that with more effort you succeed versus with more effort you can't succeed? I think it's hard for people, right? Because for some cultures, right, effort is unlimited when working with your family. You just keep on trying, even though you don't think you'll ever see, but you just have to keep on trying because that's what you do in your culture. Or some countries you just give up because why do you want to waste time? Yeah, I know technically we're blood related, but yeah, that's a waste of my time. A better thing to do. I think really we're bad judges on how much effort is rewarded. And so we just have doctors who always try and doctors who don't. I think we really need to have a medium where you have doctors who judge how futile this effort is and determine then how much you keep on trying.